Welcome to the Rotary Club of Hudson. My name is Tom Tobin, president of the club, and we're thrilled to have you join us today. This meeting broadcast is available on HCTV as well as our Rotary of Hudson YouTube channel. Our club meets weekly at Laurel Lake for breakfast on Wednesday mornings from 7:15 to 8:30. Come out and join us for a meeting. We would love to have you as a guest. To learn more about Rotary, our club, and the impact we're having on our local community and the world, visit our website, rotaryhudson.org. Enjoy the meeting today and help us share the message that Rotary connects the world.
Welcome, Rotarians, to the fine Rotary Club of Hudson. Rotary Club of Hudson. Chop that, take that out, James. Here we are on this day. First of all, I believe that Catherine is going to do the prayer this morning. Thank you, Catherine, for volunteering.
Please join me in prayer. Dear Heavenly Father, we just want to thank you for this group of people together. We thank you for the food. We thank you for the friendships. Lord, we pray that you will help us to be good stewards for you, that you will help us to share the Rotary service above all, and that you will help us each to do the right thing, to go out each day and proud to be a Rotarian and to share that and to do good. And in Jesus' name I pray. Amen.
Amen. All right, the lucky candidate for the four-way test and the Pledge of Allegiance. Who do we have? Joe Avella. Joe Avella, come on up. It sounds like we have a little disgruntled Rotarian.
He's just very efficient.
Okay, please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And the four-way test, first, second, third, and fourth.
Joe, thank you very much for doing that. Okay, now we have a very esteemed person with us, man of esteem, high-level quality. He's going to do the song today, Dr. Phil Tobin.
Let me paint a picture for you as we sing here. This is 1939, and you're in New York City, and you're in a ballroom on the top of the Rockefeller Center. And the singer is dressed in a dark blue gown. She's rather large. Who am I talking about? Kate Smith. Kate Smith. Okay. I'm Kate Smith today. We're going to sing. That just blew that image altogether. This is God Bless America. And James?
It's up there. You got it.
Okay. God bless America, land that I love. Stand beside her and guide her through the night with the light from above. From the mountains to the prairies, to the oceans, white with foam. God bless America, my home, sweet home. God bless America, my home, sweet home. Hey.
All right.
Thank you.
Thank you.
Thank you, Phil. All right, Bill Libby, could you come up, please? Bill? No, not here?
Yeah, he's there. Bill's here somewhere. There he is.
Bill, I'd like to present you with your big boy badge.
You don't know how long it's been taking to get this, 5 months. It's easier to become a new member than a transfer. Okay, thank you.
I'm glad you're happy. Oh, and by the way, we're going to have Bill come back another week and finally do an introduction of himself to the club. So you
And-
probably all mostly met him already anyway, but I think it'd be good to cross that T too.
And Bill,
All right.
we're working on shortening that process by a whole month, so we're going to get down to 4 months, so bear with us. All right, so with all that being said, Chris is gone, or she had to leave?
Yes.
Did you want to announce our guest, sir?
Yes, I will announce our
All right,
guest.
everybody welcome Tom Tobin, our
right.
current president.
Thank you, Rich. Thank you. All right. You're doing a great job at your Sergeant of Arms duty. Thank you. All right. We just have a few guests this morning. We have Jim Redmond from the Akron Rotary Club visiting this morning. Jim, congratulations to your club for a very successful Chili Open this year. I think I saw some big numbers there. So.
Well, thank you again for anybody who bought a raffle ticket or participated in our event or actually came out and actually played in it. We did raise $300,000 for the first time ever. That's great. And those are all the special children from Hudson, from Akron. Really, it's our community, our regional camp. So I want everybody to think about it. Thank you again.
So it was over $300,000 for that they've raised for children throughout Summit County, beyond Summit County too, or is it pretty much Summit County? Northeast Ohio, and a fabulous camp they have out there. So, thank you. We also have Marty Bach and Jamie Cosman from the Service Learning Club this morning. And as a matter of fact, I may just ask them to step up right now and introduce their special guests today. Always a pleasure to have the Service Learning class folks with us. We're so proud of them.
Good morning, Rotarians. I'm Jamie from Hudson High School, as Mr. Tobin said, and we have some outstanding students. And speaking of outstanding students, Mr. Bach and I and Mrs. Von Velmasamy have made some very, very tough decisions, and actually just yesterday finalized our next year's class. They don't know this yet, but we did, and it was such a struggle. We had so many kids apply, and the hardest part is that we have to say no to so many great, great kids just because we don't have the room. But I guess that's not a terrible problem to have. Our first student who's going to be speaking is going to be Cindy, who not only, so last semester she volunteered at Ledgeview Elementary in Macedonia, where I got to see her just be absolutely outstanding. But this semester she made a transition to Hattie Larlam, which has been a unique experience for her. So I'll let Cindy speak.
Good morning, everyone. Thank you for having me. As Mr. Cosman said, I was at Ledgeview Elementary the first semester, but now I am at Hattie Larlam, which has been kind of a hard transition for me. You know, everyone there has sort of more advanced special needs, and they're all nonverbal, so it was a little hard for me at first. But there is one resident there. Her name is Misty. She really likes the color blue. So on her chair, she has a little like a tray in front of her, and she has a blue blanket covering it with like a couple dolls that are wrapped in blue blankets, and she has a little blue speaker that she listens to music on the whole time. But one day, one of the crafts we were doing was drawing llamas, and if you ask her questions, you ask her yes or no questions, and for yes, she kind of smiles, and for no, her eyes, they dart one way, and you tell she doesn't want to do that. So we were drawing llamas, and we asked her what color she wanted her llama to be. We went through all the colors, and then we're like, okay, do you want your llama to be blue? And she said yes, and she was smiling and very excited about that. And then we asked her what color she wanted the sky to be. Again, blue. The grass, still blue. So everything, she ended up with a picture of a blue llama, blue grass, blue sky, blue clouds, blue flowers, everything. Everything was blue. So that was a really good experience that I had there, just seeing the joy in her face with her blue llama. Next year, I plan on going to The Ohio State University and majoring in biochemistry, hopefully staying on the pre-med track and maybe becoming a dermatologist. So that's the goal. So thank you.
So good morning, Rotarians. Lovely to see you. So the next student I'm introducing is Abby Silcox. Abby, especially first semester, one of the things that was great about Abby is we offer extra service opportunities beyond just their site work. And Abby by far did the most of anyone else. It seemed like her energy was limitless. She was all over in terms of doing bingo or babysitting kids or first serve or that. It just seemed like Abby was everywhere to be found throughout Summit County doing something service-wise. So she's definitely one of our superstars. So I'll introduce Abby Silcox.
Good morning, Rotarians. So I'm Abby, and my first semester I was at Kent UDS, which is Adults with Special Needs, and this semester I'm just over at Eva Mir. So my first semester when I was at UDS, it was definitely very out of my comfort zone. I had never been in that kind of environment before, but I made some of the best relationships ever there. One specifically, his name was Alex. He loved to read, and so every day he would go to the library with his assistants and get new books, and then the following day I would read those books with him, and it was just so cool to have that opportunity because he wasn't able to read books. I would read him a few lines and then he'd present it out to the class, and it was just really cool to have that experience and to be a part of his life like that. And so I still go back and visit him. He's just such a sweetheart. So yeah, and then next year I plan on attending Bowling Green, and I want to study art education and psychology to hopefully become an art teacher or an art therapist. So yeah, thank you.
So as you can see, we've got just a huge variety of experiences, and what I love about their stories is they're so diverse, even though they were with very similar populations, which I think is really cool. And by the way, the Alex that Abby asked about, so he remembers every single service learning volunteer there, going back years and years and years. And when I went to see him, he's like, "Oh yeah, you came to see me 4 years ago on," and I was like, okay, wow. And he's running through all these names, and without last names, I was kind of struggling at times. And then we're piecing it together. But he asked about one of your friends too. He asked about Lonnie Banner. He just absolutely loves her as well. So I just thought I would toss that out there.
Jamie, we missed Lonnie. Can you tell us how she's doing? Give us a little status update.
She is doing absolutely outstanding. She loves it in North Carolina. She's, as you know, running that, or not running, but helping to run that, the Zen monastery, the Buddhist temple outside of Asheville, and just absolutely loves it. It's kind of her place, and she's kind of found her peace. So I'm sure she will send a hello, and I'll send a hello from you to her today. But
thank you.
And I know she misses you, but this is where she's meant to be.
Great. We have any questions for the students this morning? All right. Well, thank you so much. Really. I know I should have some more things to report on this morning, but I've been in Sarasota all this last week, and don't be haters now. Come on. I got a nice sunburn. I got a sunburn on the way from the airport to Sarasota. So just yeah. Hey, so I'm going to ask John Adams to come on up and introduce our featured speaker for today. Thank you, John.
Okay, good morning, Rotarians. Continuing with our theme of health and wellness, so 2 weeks ago we all learned about healthy intake. How's everybody doing there with that? I think the big one was alcohol consumption. She was speaking to that table over there. So anyhow, it is totally my pleasure. We're making a shift, a pivot now. We live in arguably the healthcare capital of the world with what we have going on here in Northeast Ohio. And so I thought it'd be interesting to have a representative of an administration of one of the hospitals come in and speak to us about the healthcare environment that we have going on in Northeast Ohio. So with that, I asked Mark Bosco to come in. Mark's title of his talk is Healthcare 2020, Meeting Challenges and Advancing Change. Mark is VP of Marketing and Public Affairs at Western Reserve Hospital and Unity Health Network. A little bit about Mark's background. He is completely responsible for advancing the brand and identity of Western Reserve Hospital and Unity Health Network by defining, developing, and implementing a comprehensive marketing and communication plan that addresses the strategic direction and mission of the organizations. He also serves as spokesperson and oversees the healthcare entity's public relations initiatives. Prior to this important position, Mark served as Executive Director of Marketing and Public Relations for the Northern Ohio College of Medicine, and before that as Director of Marketing for ING Bank, Northeast U.S. Market Region. Mark is a graduate of Kent State University and also a member of the American Marketing Association and the Public Relations Society of America. Please give Mark a warm Rotary welcome this morning. Thank you very much.
Good morning. Thank you all. Thanks for the invite. As you heard, I serve many companies, and they're all along the bottom there. And that's sort of very typical for healthcare today. And I'm going to talk about that, about consolidation and doing more with less. And that's where we're going to really focus this talk on. But I want to give you some insight first on what we're looking at. So let's consider some facts. Am I supposed to stand, sort of steer?
You can use this if
Okay, I didn't know if it was on camera or not.
it is on camera.
Okay, I'll try to, if you can. Everybody got me? Okay. So the first one, if you compare 1960 to 2018, and you see the growth of healthcare in our country as a percentage of GDP. I was reading last night, which you'll find even more interesting, our healthcare system, if you look at it compared to economies, the healthcare system in America is going to overtake Germany's economy this year. It will be, if you look at it compared to economies, it will be the 5th largest economy in the world, our healthcare system, greater than all the other countries, their whole entire economy. That's how important this is to everyone. That's why this is such a big deal. The worth, the change in worth you see, and then we start to talk about some of the problems, and this is where everything's going, and this is why this is happening. Right now, 4 out of 10 Americans are morbidly obese. That's a huge, huge, huge issue. That's what's driving these costs. It's the bottom line. It's really the bottom line. If anybody's interested, there was a great article that broke in the Wall Street Journal yesterday about how our healthcare system would look. You take out all the politicians if economists ran it. And it's very, very interesting because it's almost common sense. And most of it points to this problem. And I heard you talking about intake and your whatever the challenges were that you challenged the Rotarians on in the healthcare. This is really it, and this is what we focus on. 7 out of 10 Americans are overweight, and that's by BMI. That's not. That's just a scientific calculation. Obesity-related healthcare issues, $150 billion annually. And you realize what's challenging about this, that could go away. Not all of it, because we are humans and we're going to make bad choices. That's just what we do. But a lot of that could, and you consider all the good we could do with that if we just change that. 300,000 premature deaths because of obesity. Again, another problem. And this is all going to tie in here. We have some retirees in the room. Healthcare plans vary. $5,000 the amount is sort of the annual you can expect to pay for out-of-pocket costs every year. 4%, huge number. That's a big number of people are declaring bankruptcy every year because of their medical bills. It's an easier route for them. And then finally, and this takes a shot at me, quite honestly, $175 billion we could save by making administration, people like myself, more effective. The way we deliver and administer healthcare. It really could change, and I can speak to that for 20 of these meetings. I feel like I'm pretty efficient, but I'm sure we all do. It could change. We could do a lot better. So that's the global situation that the United States is in, but that's also the situation Western Reserve Hospital is facing, Unity Health Network is facing, the Cleveland Clinic is facing, Summa Health is facing. So it's global, but it comes all the way down to us because those statistics play out in every community, and they really do. So how do we attack it? 3 things. The first is a big one, really, really big, and the consumer responsibility. I'll talk a lot about that. My president, Dr. Robert Kent, some of you in the room know him. He's a big game changer. That's his big deal. Consumer responsibility. Healthcare is our responsibility. We have to get away from, I want to just go to the doctor, make me feel better, take care of me. I want to eat what I want, drink what I want, don't exercise, fix my problem, give me some medications. It can't be like that because we've gotten into the situation we are in because of us all being like that. Innovation and technology, we'll talk a lot about that, and then value, access, and costs. And that's how it's all changing. So consumer responsibility, the government can't afford it anymore. They really can't. If you pay attention to some of the metrics, you'll see what's going on. 2026, that's 6 years away. That's when they say Medicare's trust fund is going to evaporate. We're going to be done. What do we do? I don't know. You know, people in my generation, I'm not that young, but myself and some of my younger peers, that's a concern for a lot of us. What do we do? Don't know. What they're trying to do on the government side are some things. There's a lot of initiatives going on. There's apps they're building. Hospitals must post price lists, which is very confusing. Has anybody in this room gone to a hospital online, on their online site, and looked at their pricing lists? I didn't think so. We do that. We've spent months putting that together and making sure it's appropriate and within the guidelines from the government. Our hospital has done that. It's pages and pages and pages and pages. If you go to the Western Reserve Hospital website in the financial services department, you'll find that online. It's hundreds and hundreds and hundreds of pages that we had to work through and make sure it's posted correctly. I don't think anybody's accessed it. The first month it was up there, I pulled the analytics from our website. 2 people had looked at it in 30 days. Yes. There you go. That's the ineffectiveness, exactly. And then drug makers required to disclose list prices in their TV ads. Has anybody ever noticed those? I do from a marketing and a PR perspective. I pay attention to ads all the time. It's probably about that size on your TV screen, maybe that big. And it'll have some very generalized text around it. So it's, again, they're trying. It's, you know, it's bureaucracy, et cetera. What are employers doing? There's likely employers in this room. Here's what we're looking at. In the hospital, we are a self-employed organization, Western Reserve and Unity Health Network, so we worry about this. We take care of our own. 2018, the average annual for a family plan was about 20 grand, and the single was almost 7. Employers pay 82%. We carry the burden of that. America still does a pretty good job in taking care of their employees. I know you hear there's a lot of buzzwords in the news. People don't have coverage. They do. We provide a lot of coverage. Our organization does for all of our employers. This year, 6%. Now, if anybody in here is running their own business and somebody says you're going to take a 6% hit for an expense, how do you make up for that? How do you make up for that? We're trying to mitigate this. High deductible health care plans. I don't know how many people in this room have one of those or have encountered that. That's the trend. If you look at just in 10 years, I can tell you from my own sake, I'm carried on my wife's insurance. She works for SG2. It's a healthcare consulting firm out of Denver. Our deductible is about $1,500, and we have a Cadillac plan. It's just my wife and I. We don't have children or anything, and we're both very healthy. We have to get physicals to qualify, all that, and that's a Cadillac plan. The world has changed incredibly. This is where we're going. So what else are we doing? Responsibility for your own health. Incentives for wellness, smoking cessation, and well visits. This is what has to be done to mitigate all of those issues we're starting to face that are colliding into each other. It's not just the obesity, it's the costs, it's everything that's going on. We have to push back and give this to the employee. We have to all become responsible for this because this is what's going on. And then we also have to consider social determinants. And you hear these buzzwords a lot, like what is going on in our country. It's not all executives are worrying about who have the time and the ability to go running in the morning before work or go visit the gym and consider different diets and stop smoking and all that. We have a lot of cultural issues. Cuyahoga Falls, where the hospital is located, we have huge Bhutanese and other people in the community in North Akron. Anybody familiar with North Hill? The communities there. We carry probably 4 to 5% of our staff employees are from those communities. We have to consider stuff like cultural issues. What is their workplace like compared to what they're used to? What about their food needs, their insurance needs? These folks also visit our ED a lot. They come there for dental problems. That's a cultural issue. That's not what you go to the ER for, but how do we help to educate these folks to start to push back, because that costs us and that costs the community. Increased healthcare costs, we have to worry about that. Again, we have to find out how we can get to the consumer, how we can get to the patient to make them more responsible and understand what has to be done to take care of themselves to drop these healthcare costs, or we will have a crisis. The second point of how we battle this, so you take it away from the consumer, okay, we're trying to educate them. How do we help them take care of themselves, make sure they're doing all they can to be healthy and take care of their own health, is innovation and technology. And I'm sure we're all bumping into this all the time. Does anybody have a Fitbit or something like that on this morning? Okay, that's number 2. Wearable tech. That's not the only thing. I talk to a lot of vendors that come to the hospital. There's a lot of clothing now that's infused with technology. My wife has lupus, so she has a ring that monitors all kinds of stuff. It literally looks like my wedding ring. It's just a very basic silver band, but it measures about 6 times what her Fitbit measured. And it was an early adopter kind of item that we worked with a vendor on. AI and machine learning, and I think I have an example later, but I just saw a story yesterday on the Mayo Clinic on breast health, how they're improving that through AI. It's very predictive. It's predictive science that is so important now for healthcare. You know, identify diseases, diagnose conditions. They're looking at that. And Amazon is working heavily with that. And there's a lot going on in innovation and technology. I can't cover it all, but these are the key things. If you look at that, 80% of the people are willing to wear wearable tech. They really are. It's very easy. And when it started, it was a little different, and you know, you'd see people and you'd notice it. Now it's almost what people wear, and you see it. The AI and machine learning, and you look at the data. A gentleman here, the guest said he knows one of my coworkers, Kevin Tice. Kevin Tice is the COO of Unity Health Network, the other organization I work for. Huge proponent of big data because of this stuff. 2020, medical data will double every 73 days. The massive amount of data we have right now on people and their health issues, that's going to double every 73 days. You have to have a way to work through that and figure out what you're going to do with it. 3D printing. The medical director of our emergency department was telling me about some of the 3D printing they're using for throat pieces and when they're out in the field that the EMS crews are using. And I don't know if we have any Hudson EMS people that attend these meetings or are members. They're very advanced, and they do a lot of, they're on the cutting edge of this. They're not using it yet, but we partner with them a lot, and they're very interested in this. It will change EMS. Genomics, they're looking at, your backgrounds. We probably saw a lot of the news stories about the 23andMe's and all those similar products and how that data is being farmed. That could be dangerous, but it's also a good thing because that data is very predictive and it's going to help with all that. And then telehealth. And I talk a lot about this a little bit later. Anybody in this room utilize telehealth? Called up your doctor? It's wonderful, isn't it? The 2 young ladies who are here, it's going to be your whole future. It will be your whole future. It's hard to tell someone to go to a typical office visit anymore if they're under 30 years old, when they can sit in their car, in a parking lot, on their smartphone, and have the same encounter and not leave their car. And then, oh, by the way, in maybe another year, maybe less, the prescription you needed, Amazon's going to drop that off at your doorstep via a drone. And that is not science fiction. That is happening. They're already testing that. That is what's coming. Telehealth is changing everything. It's changing everything. Unity Health Network just started their own dedicated telehealth. So if you are a Unity Health Network patient, you have access to a telehealth doctor. We also use, on off hours, the Western Reserve Hospital ER physicians. So it's like going to the ER. We're going to start promoting that in a big way. That's what people want, the convenience. We want that kind of convenience. You don't have to leave your house. You don't have to go anywhere. You don't have to go to the pharmacy. This is great for people like myself, actually for everybody, but especially so for senior populations. Locations like Laurel Lake, it's great. We're working on telehealth partnerships with organizations like Laurel Lake so that we can have a nurse or a nurse practitioner in the facility and they can just dial up the doctor. Soon they'll be able to dial up the specialist and they'll have the same access. So it's an access point issue, and that's how we're battling all of those data points you saw at the beginning of this presentation. And then finally, value, access, and cost. And anyone who's been to a primary care physician or any physician in the last 5 years has realized the increase of the tablet or the laptop in the room, the exam room with you. And that's what all of this goes to. This is, again, the government working to reduce costs. So we're moving away from fee-for-service and focusing on value. Fee-for-service in the physician's world is you get paid by the more tests and the more activity you perform with your patient. So you're looking at a patient, and patient A needs 2 tests and a couple office visits and maybe an MRI. The physician and then the other physicians involved get paid based on each one of those activities is how you would look at it. They need to move away from that, and that's what most firms are starting to do, and they go to quality or value. Those are interrelated. What they're doing is they want to look at the patient's total health, and you get reimbursed for the way their health improves from the first visit through that whole episode versus incentivizing a physician to order a lot of tests or a lot of different things that may or may not be needed. Now, physicians are always tasked with doing the right thing, but there have been times when they're looking at too many tests or maybe, and we've probably all had these experiences, you go to one facility and you get an MRI or an X-ray, and then you go to another and it seems like they're replicating that test. Electronic medical records focus on value is eliminating that, and that's very, very, very important. Increase access to and offer more levels of care, urgent cares, primary care offices, quick clinics, telehealth, all of that's working toward that. Consolidate operations, that's going on, and we'll talk about that. Reduce the bricks and mortar, and then educate consumers on where to go when. That's trying to deliver the correct care at the correct place at the correct time. So you don't show up in the ER for dental care. So you don't go to your primary care doctor when all you need is, a salve on your finger. We need to work again on pushing the consumer to taking care of themselves. Consolidations are very important on a business side, and we'll talk about that. Value-based, I spoke about that. It's decades old. Fee-for-service model has to go away and get away from units. This is not happening everywhere, not yet. It's happening a lot in our part of the world because I was speaking this morning before we started the meeting. Northeast Ohio, we're all extremely, extremely lucky in where we live because of our access to healthcare here. We have the greatest heart center in the world just up the street in Cleveland, the Cleveland Clinic. You cannot get any better care than they provide. We have university hospitals, Summa Health, our own Western Reserve, Akron Children's for youngsters. You can't get better health care. We are so, so, so lucky. So all of these things I'm talking about are happening in a very meaningful way in Northeast Ohio. In different parts of the country, in the South, not so much. Obviously, on both sides of our country, on the coast, this happens because of the populations. But these things are happening here a lot, and that's very, very important to everybody in the room because you're going to experience this, and this is what's happening. How does it reduce costs? The physicians, the people I work for in the hospital I work for, we get paid on outcomes, not just on numbers. So it sounds funny. I always try to tell people, one of my jobs is to help educate people on that we are trying to keep you out of our hospital. I know that sounds very odd from the marketing guy, like I don't want you in our hospital. But the less people in our hospital, the better job we're doing because we're either educating you on how to stay healthier, we're educating you on better paths to health. So maybe it's not always coming to the hospital, or we've just done a good job on making sure you're getting the care you need where you need it. And not always the hospital. Going to the hospital is the most expensive option there is. And it's funny because I can relate to it very personally. When I was 16, I had to have my appendix out in a semi-emergency situation. I was at Robinson Memorial Hospital, now UH Portage, I believe they call it, for 17 days. And nobody thought that was odd. Like, that was just what it was. One of my teacher aides came from Ravenna High School and brought me my course lessons and stuff like that. I mean, I know it's a different world, and I could have done it all online now, but that's how it was. My wife had her appendix out last year, outpatient surgery. We were in the hospital maybe 2.5 hours all in. So, yeah. So you have to, that's how the world has changed, but that's what we're educating people on too, because we run into people, and I spend a lot of time on the floors of the hospital. I have people saying, I think I need to be in the hospital longer, and we don't want you. So it's a paradigm shift, as it says. We have to help people understand we have to work on this. This is a huge part of our economy. Healthcare is such a big part. It affects all of us. It's very personal, but it's also a big part of money, and it's a big part of life, and it's a big part of business. So we have to make it more efficient. We really have to do these things. Unprecedented access. So you have value. That's one of the ways we're working on it. We're making physicians look to treat you in a way that is based on value versus just pieces and payments for those pieces, but then increase access. Retail clinics. Now, this is sort of stopped and started, I think. I've read a lot of articles about, oh, there's a whole new chain of them going in, but the Rite Aid clinics all pulled out. And they made those big news. They had I don't know if, yeah, what they did is they created, like in the middle of their stores, almost like a kiosk that was completely enclosed. You went in there, you got almost like an urgent care center. And you went in there, you got care. But then they pulled them all out. Now the Walgreens clinics are very successful. And now CVS, in their partnership with Target, is looking at expanding theirs as well. So I think it might depend on the operator. However, people go to these a lot. So if you go into a Walgreens, they're pretty busy. They really are. A couple of the nurse practitioners we've hired recently have spent some time in those locations, and I've had conversation, and they say they're very busy. Not so much in Northeast Ohio, but they are busy in other parts of the country. Urgent care clinics. Western Reserve has an urgent care in Stowe on Route 91, not too far away. And so do some of the other organizations, open nights and weekends, and then video visits, which is a big deal. One of the other emerging access important pieces, is concierge medicine. I don't know if anybody does that in Hudson. Is anybody aware? So what it is it's a great service. You pay a physician basically a flat fee once a year, and you have a bank of hours of access to them. It could be 5 a.m. on a Sunday. It could be 2 in the afternoon on a Wednesday. If you're connected to that physician, he's your concierge doctor. He comes over and sees what's going on with you. It's a great plan if you can afford it, and it makes sense for you. I would love to have that. That'd be a good deal. That's one of the other emerging ways that we are working to get rid of the problems in the healthcare industry. Telehealth, that's what I mentioned earlier. The increase in growth, 1,202%. There is, everybody they interview, there is no barrier to this. Because if you utilized it, especially with a pad, it is so easy and so flawless, and they've really got it nailed down. Willingness of consumers who want to utilize telehealth. So it's an ongoing physical condition, 62%. Initial physical condition, 43%. So that means the very first time. You may never have met the doctor before. Very first time. 43% of people are, yeah, absolutely, I'll do that. I'll log on and call up the doctor and go for it. Mental health, huge opportunity here. We probably have seen the ads on TV for some of those, basically call up a therapist on your smartphone. You log in and you get assigned one. There's several companies that do that now. This is a big issue, and it's a big growth area because there are not enough psychiatrists and psychologists. Behavioral health is a huge problem. I'm sure your group has addressed it before. Suicide crisis, etc. There's just not enough caregivers to take care of this problem. It's a big issue with the young people, so the young folks in the room probably can relate very well to this. Big problem. Healthcare is not prepared to take care of this as we stand right now. We just aren't. We have in our group, we have 130-ish odd healthcare professionals, physicians and providers. We have 2 psychiatrists. That's it. And that's really pushing it. And those 2 both have very short, tight schedules. It's just there's no one doing it. And then emergency situations. So what's interesting, again, back to the Hudson EMS, stroke care. Hudson has a fair amount of senior population. So we're working with Hudson EMS to devise how do we, when EMS shows up and there's the thought it could be a stroke, how do we work with our physicians before they even get to the ER? And we're going to call them up on a tablet, and so they can link to a neurologist and work through those things. Again, it's the electronics, the integration of technology, telehealth, access, increasing access to lower the costs of healthcare and the demands on the healthcare system. So if you look, I talked at the beginning about becoming more efficient and consolidation. Summa Health just was purchased locally by a company out of Michigan, a huge healthcare system. What they do is they help in the consolidation because they will reduce costs. Without competition in the market, if we were a single hospital system, and there are some of those around in the country, there really are, especially in the South, in the Mississippi, those areas. My wife consults with a couple of those. $2,000 more per admission in a hospital if there's less competition. And that goes through every business. We're all aware that business people in the room understand that competition helps with the pricing. But in healthcare, it's really, really, really tough. 12% more average for primary care and 34% more for specialists. And again, it probably sounds funny, but I'm endorsing that because we're here, Western Reserve Unity Health Network, actually all of our peers want the community to be healthier. It's actually better for all of us. We don't want to make money because we're the only ones in town doing the business. But that is what happens. So there has to be consolidation, and that's part of the cost and value discussion with how we battle this. Avoiding traditional inpatient care, again, access. It's all about access. So those of you who've people utilize urgent care in this room. Has anyone been to an urgent care center? There's a couple. I myself. Huge increase in those 10-year periods, 5-year periods, telehealth and retail clinics. These are the 2 growth areas. This is still growing, and that's more due to population growth than it is so much to people not knowing where to go. I'm sorry? Emergency department and ambulatory surgical center. So those are non-hospitals instead of just rolling into a hospital for service. Sorry about that. So let's boil it all down to what's going on locally. We are all experiencing this. It's not just a national problem. It is our problem locally. Everybody in this room, if anybody works in healthcare or you visit healthcare, which we all do, it's a problem, and you're going to see these things. So there are every organization in our region is working on all these things we said, and here's what they're doing. Cleveland Clinic, they performed more than 100,000 virtual care visits. So this isn't just their telehealth. This is actually, and my wife sees, and I can relate to this, my wife sees a specialist at the Cleveland Clinic. She sees her name's Dr. Ko, she's a wonderful physician. She sees her virtually, and that's what they're talking about. This isn't just, oh, I got a rash on my arm, you put your camera up, you're talking to the doc, you work through that. They have 5 times that number. This is truly specialist and primary care office visits that they're doing. This is an amazing number. And if you're connected with the clinic, I've never seen an organization do so wonderfully at this. As soon as you walk in, the nurses, the physicians, they're all talking about their virtual care because they know this is the future. They want to increase access. They realize they're the Cleveland Clinic. A lot of people want to get to the Cleveland Clinic, and they want to get to their physicians and their specialists. How do they improve that? How do they increase that access? This is how they're doing that. University hospitals, we talked about making things more efficient. Administration, people like myself, how do we become more efficient? They just realigned, and it was a big deal business-wise. I don't know how much this made the news. I saw one small news blurb, but it's interesting to look at the people that we're working with all the time to increase efficiency of operations. And they really did shuffle people a lot. They really did. And it's supposed to be a great deal for their organization. Summa Health, this is a really cool one. They utilized AI to realize a 662% increase in number of lung health patients identified for nodule tracking follow-up. So what this means is, take sort of that out of there. I'm a smoker. I've been identified with a possible problem. They've identified a nodule. I'm not always that great on following up. Many people aren't. It's just something they don't do. They've used AI to identify these people and know which ones are not going to be the follow-up people, and then they go and reach out to them relentlessly and get to them instead of me putting it on me. So it's sort of the inverse, what we said has to happen, but technology is allowing us to do it in a more efficient way. And that's a huge deal. That didn't get a lot of media, and anybody who's paid attention to the news probably thinks, wow, there's the guy from Western Reserve promoting Summa Health. But they really do great things. They do. And that's one of them. They should brag a lot about that. Ourselves, we expanded clinical specialties, and we're adding trauma certification. So what this means, again, it's getting to the efficiency. Right now, if there's a traumatic accident that EMS responds to, and they're 3 feet away from Western Reserve Hospital, they bring them in the squad, they pull in, we can't take care of them because we are not trauma certified. So we will stabilize that patient and then ship them to Summa or somewhere else. Do you know how crazily ineffective that is? Not only for the patient, but also cost-wise. It's an unbelievable amount of money. Once we become trauma certified, they can stay there. They come into our hospital, they get treated in the ED, they get treated by the trauma surgeons, and then they get put into a room for care. It's better, way better for the patient, and way safer, much more safer. So that's what we're doing. Pioneer Physicians Network. Anyone here familiar with Pioneer Physicians Network? Okay, great group. They are a large independent physician group like Unity, like the one I work for. Dr. Pinta, Dr. Lissy, 2 wonderful physicians from that group. They've created after-hours clinics. So what they've done is they've selected 2 locations within their chain of offices and made those locations like urgent care clinics, which is an interesting concept. So you're already familiar with the doctor. You're not rolling into some urgent care that you may or may not be aware of, and you get to go there after hours on weekends and get the urgent care in their offices in a primary care office setting. Great idea. Crystal Clinic, same thing, gave it a tweak though. It's for orthopedic specific injuries. Very, very, very efficient and effective way to treat that instead of sending those people to a hospital or an ED. Saving money for the Crystal Clinic, great business decision. It keeps the people in their network, and the continuum of care for the patients is improved. And then Unity Health Network. What we've done is Call Unity First. Call Unity First is a program that tells patients to call their primary care doctor first. And what we do is we have a 24-hour-a-day nurse triage program. You call the line. If it's after hours, you are connected to a nurse practitioner. She walks through what's going on with you, and then she helps you make the decision, oh, you better get to the ED. Here's an urgent care center that's open. They can definitely handle that. Or depending on how late it is in the day, we keep appointments open for these kind of calls. We have a doctor at our Cuyahoga Falls office who will see you in 15 minutes. Or we're going to stabilize you. You can make it till tomorrow. Here's some things you can do. It's helped us incredibly, keeping patients in the network, but also reducing costs. And I do have data if anybody's really interested on it. It's astounding how many patients we've kept out of the ED doing this, and that's a big deal for us because what it does is it plays back to the government's roles of reimbursement and keeping all these costs down. My organizations, just quickly, so I actually work for 4 organizations, and you know about some of them, but this is the interesting one, is Ohio Independent Collaborative. Again, working on effectiveness and efficiency. There are about 1,000 physicians that belong to that. It's based in Cuyahoga Falls, and to take care of about 1 million people across the whole state of Ohio. So what it is it's every independent physician almost in the state of Ohio belongs to that. So we share ideas, we share thoughts on care. financial information that will help us all succeed more. But it's great because then we can help our patients look at different organizations, and there may be a better fit for them across the state if they move. It's just a great way to keep everybody connected. So that's what I do in my world. Last thought, and this is a really cool one. Maybe some of you bumped into this before, but we've talked about this. So you consider healthcare. Healthcare is really a service industry like all of these. So Netflix. I grew up in the video age. I loved the video stores. There was nothing better. You know, you can go to the video store and you can stand there and look around, rent your movies, pick what you want. They didn't kill Blockbuster. Late fees did. And so did access, just like healthcare. I'm sitting on a plane. I can watch a movie. I didn't have to worry about going to a video store and getting it. It's access. Airbnb didn't kill the hotel industry. Again, access, pricing, two issues in healthcare. Amazon didn't kill retailers. Who doesn't love Amazon Prime? You know, well, my UPS guy doesn't, but maybe he does. I don't know. iTunes didn't kill the music industry. You can buy, you only like one song by an artist, that's what you get. You don't have to buy the whole album. And then Uber. I just Ubered from the airport yesterday. Didn't kill the taxi business. It's about a third of the cost of the cab from the Cleveland airport to the Western Reserve Hospital. All of these things that are going on across the world now, these changes, one day, 5-10 years from now, you're going to see an icon down here about healthcare, and it's going to talk about how the industry changed. And that's it. Questions?
Questions for Mark? We have time for just a few.
The quick one. Amazing presentation. It covered literally everything. My understanding, so having been in the hospital with all those tests, my understanding is that a lot of the tests are fear of liability. And so a doctor may say, you know, there's only a 1% chance of this thing happening, but if he or she doesn't do the test, then they may be liable. I'm wondering how are we able to address that so that we don't do a lot of unneeded tests just for fear of liability?
That is a great point. It is changing. There is always that concern, the clinical appropriateness, we call it, with regard to testing. That's always going to be a challenge. Some of the data points, however, is putting it back to, so the doctor may say there's a 1% chance. It often can go back to the consumer now. So, you know, Mr. Smith, here's what's going on. There's a 1% chance, you know, it could be this, and we could run a test. And that's the point. Actually, people are now talking about the cost of that test, the timing of that test, the location of that test, and then the decision becomes a co-decision. The way the government has set that up to reduce the cost, if those are a mitigating factor in that equation, the government won't ding the physician for ordering that test. They understand that there's times clinical decision has to override pure efficiency. So that has been thought out, but that's a great point.
Mark, first of all, great presentation. You talk about keeping patients out of the hospital, yet you can't drive by a hospital and not see cranes and more construction for patients to come to the campus and stay there. Cleveland Clinic, I mean, the blocks and blocks, as an example. The healthcare tower we just saw with Summa. So it just seems like your statement about the systems aligned to keep you out, which I understand is true, yet the practicality of seeing all this construction going on at hospitals all the time seems to be in the face of that.
Correct, and that's a great point. So with the Summa example, you know, they quietly closed St. Thomas, so they lost all of those beds, so they had to move them downtown. It's their, I guess you would call it an internal consolidation that's bringing their pieces together. Probably less effective for the patient population. The other side of it, because now they all have to go downtown, but the other point of that is that a lot of the growth physically is due to outpatient procedures. Our hospital runs on outpatient procedures. I believe it's about 6 or 7 to 1 outpatient to inpatient at least. So a lot of those facilities are building up to build through that. So they have what are called almost a super outpatient center. And then you can go streamline through and do all the tests you need to. Summa, again, has done a good job of that. They have their cancer clinic. It reminds me, I don't have children. My wife and I have dogs our dogs have had health problems. When you take them to Ohio State, all of the specialists come in at once. It's very unlike human healthcare, and we could all learn a lot from that. SUMA has learned from that. So now if you have the specific cancer, I can't remember, when you're being cared for, all of the specialists come in and meet you together, so they're looking at you holistically and taking care of that, so you don't have to go to 6 different places, because they know, one, for patient care, it's awful, but that's a lot of that building is allowing for that. So if you, all of those offices are all there. But you are right, there is always, especially downtown, when you're at Cleveland, the campus continues and continues to grow.
We have time for one quick question.
Yeah, in my second life, I've gotten involved in Medicare health insurance, and I view supplementals as fee-for-service and the Medicare Advantage as managed care. And in talking to my clients, a big issue, and 60% of the market is still supplemental, and in people I talk to, that's not declining at all. Amongst several considerations is networks, especially if they travel. Do you see that? Do you see that as I see that as a impediment to putting out managed care. Do you agree with that?
I would agree. The government is really hammering the Medicare Advantage and working with groups like our own. They would love for it all to be Medicare Advantage, obviously, as you well know. The impediment is exactly right, is the networks. How do I move my care? Absolutely, absolutely. The hope is, with regard to a lot of the technologies and the telehealth options, that we're going to be able to create almost virtual networks, so those folks that are traveling or that want to move or do those things can still stay in a, quote, network, although it's more electronic. Now, that electronic care is still a barrier, especially with the senior population. My mom does not like telehealth. I walked her through a telehealth encounter about 6 months ago, and it just didn't work for her. She's 87. She's very lively, very, very independent, but it just wasn't a thing. So that's still a barrier. I think we're going to see a slow shift. As the younger generations embrace this, this almost becomes natural to them. They're not going to the neighborhood doctor anymore like I used to with their $6 and, the waiting in the waiting room seeing the doctor. They'll think, what are you talking about? It's all telehealth. It seems bizarre to all of us. It really does. But all this would have seemed really bizarre to me 10 years ago, what's going on now. So it's a great point, though. It's a great point.
Mark, thank you so much.
Thank you.
Really
Appreciate it. Absolutely.
excellent messages for us this morning. Mark, I don't know if you have to leave immediately, but if you have a moment to stay, I'm sure some folks would like to ask questions. All right, really quickly, Rotabuck, I picked a ticket this morning, 2992. 2992. All right, Mimi wins. You win $11. Jackpot is $111. By the way, we have a Hudson Rotary Foundation meeting immediately following this meeting. All Rotarians are welcome. Greenwood Private Dining Room. I never will get that right. I don't have to hold it very high for Mimi.
From the vertically impaired to the vertically impaired.
All right, here's your $11. Yes, you may. All right, let's all go out there. Oh, one bit of bumper sticker wisdom I saw down in Sarasota that maybe fits in here. Despite the high cost of living, it still remains popular. All right. Let's all go out there and show the world why we are proud to be Rotarians. This meeting is adjourned.